Okay. We'll move on to the next topic, which is administrative part of private practice, and we would want to call upon Dr. Tushar Grover. He'll be talking about formal training to be required for training bar MBA. Whether does it make it easy? Over to you, Dr. Tushar.
So thank you. My gratitude to Yossi for having me here. Once I have the slide, okay. So I'll be talking in favor of formal training or an MBA and why that makes it easy. So I'll be talking about why formal training is important and why learning on the job may not be just enough. So starting out with formal training. So essentially, we started talking about eye care as an industry only recently. We hear about mergers, acquisitions all the time. There are newer challenges coming in. Standardization of rates is being talked about. So, we've done more than 10 years of medical education now, but nobody ever taught us how to deal with any of these challenges. Which is why formal training in administration or business gives you that. It gives you a basic understanding of how finances works, how operations works, strategy in terms of business. All of these things are important to have a good baseline knowledge of before you start implementing anything. I have done my fellowship from Narayana, I've done my post-graduation from Arvind, but when I was doing the course, I was able to visit these places and look at it from a completely different perspective. When you're studying there or working there, you never even notice those things. You never know how they overcame those struggles or how they managed those volumes or how they grew. It's just something that you never think of, and the only way to do it is to really do an organized course and therefore get a better understanding of how these things work. You also, when you do a formal course, you really get better at managing people. You organize events, you organize seminars. There are formal courses on training with people management, and this is something that really helps you in the long run. Also, the people that you're doing the course with are all people in different branches, different fields, doing extremely well in their respective fields, and they're a great network to have. So even now, when I have challenges, when I have difficulties, I call one of them who's in an area which I know would be related to my challenge, and I get great answers from them, something which I would never get from my doctor friends or my ophthalmologist friends. Also, you learn problem solving skills in an organized way. You read all these case studies, such as these Harvard case studies on various organizations that were facing challenges very similar to what we might be facing in life. I mean, whether you want to scale up a hospital or you have other operational challenges that you're facing, you read these case studies, you see how those people managed, how those organizations overcame those challenges and were able to get over it. So that also really helps you. Again, very important is that when you're taking administrative decisions, you need to take the decisions as an administrator, not a clinician. And having organized training gives you that ability to dissociate the clinician in you from the administrator, so that when you're taking those kinds of decisions, it's not the clinician in you that is taking that decision. So talking about why learning on the job may not be enough. When you're learning on the job, essentially you know only one way of doing things, the way that you do things or the way that things have been happening in the organization before that, and you tend to have a very myopic view of how to manage. There are bound to be inefficiencies and wastage of resources because you don't have formal training in these things, in operations, in all of these areas. So there are, at least to begin with, as you start, there are going to be inefficiencies. Understanding financial statements can be very challenging, even to those who've read financial statements many times or who've been trained in it. So, when you get something from your CA, you should be able to question it. You should be able to see what is wrong, what is not written correctly. All of these things are extremely important, and you will learn on the job, but it'll take you many years and you'll make many mistakes before you do that. When you're buying equipment, etc., you all must be knowing there are these 4 or 5 company MBAs who are going to come sit with you, negotiate with you. You need to have a good basic knowledge of how negotiation works, how finances works, to be able to take the right decisions. You might learn on the job, but you'll make many wrong decisions before you take the right ones. Again, HR and staff management is very challenging in any organization. So if you have formal training on how the policies work, how different sectors have HR policies, you're able to set in a groundwork much better for your organization. So to summarize, I mean, we've spent a decade in learning ophthalmology. I think spending a year or so to learn practice management, to learn administration in business is probably the best investment that we can do. Thank you.